Now, this comes as we learn that more Nashville firefighters were off the job in November because of COVID than during any other month of the pandemic.
Yeah, at least 124 firefighters and EMTs have tested positive for the virus, but many others have quarantined because of exposure. Investigative reporter Ben Hall looks at what that means for a department that's already understaffed.
Station 17 on West End has been hit hard by COVID.
It's definitely stressful on everyone.
Mark Young with the Firefighters Union says the department is seeing more and more employees miss work because of testing positive or having to quarantine.
When you have personnel out for COVID or other type of leave, you have to backfill this with overtime.
Young says when 5 of 8 firefighters on the same shift at West End all got COVID, that's what the department did. Their absences did not impact emergency responses because others worked extra hours to take their place.
There's some other stations that have multiple employees out at the same time.
The number of firefighters missing work because of infection or quarantine has risen steadily over the weeks. 17 firefighters were off work the first week of October, but by the end of November, 71 were off the job.
You don't want to get to a point where you are thinking about shutting down or browning out equipment across the city.
The Metro Fire Department says that hasn't happened, and in a statement said it's staffing to keep all units in service by backfilling vacancies with overtime.
If it's an emergency and they call 911, they expect us to show up, and that's exactly what we'll do.
Fire Chief William Swan said in April, as the pandemic started, that firefighters and emergency medical providers who often ride in the back of ambulances with infected patients will be ready.
The biggest issue that we have to tackle, we know we need staffing.
Chief Swan told the Metro Council during a virtual budget hearing in May the department has been understaffed for years. He requested 60 new firefighter positions last year, but was given only 6.
Paying overtime is great, but you got to have staffing so that it will make it will calm down the department and have us be more flexible and able to do a lot more things a lot better.
Overtime cost the department $4.8 million last fiscal year. It's on pace to spend even more this year. That comes as overall call volume is down. The department reported a 6% decrease in responses last month, but every call comes with a chance to come in contact with COVID, especially for EMTs.
You put someone in the back of an ambulance and you're in a very tight space, and even though we have excellent PPE, the potential of risk is very high.
Young says firefighters and EMTs are recovering from the virus if they get it, and they hope to be early in line to get the vaccine. For now, the fire department is not testing everyone in a station if one person gets COVID. The department has said they do not consider that to be close contact. Ben Hall, News Channel 5, investigates.
As Ben said, first responders should be among the first to be vaccinated, along with healthcare workers and nursing home residents. With the first doses of the vaccine expected to arrive next week, the state says the general public should have access to the vaccine by late spring or early summer.